Office of National Statistics is telling us that more than 2% of the population is now infected. That's over 1 million people in England. And when today we've reported another 60,000 new cases.
Well, we can talk now to Catherine Troisi, who's an epidemiologist at the University of Texas School of Public Health, and she is joining us live from Houston in Texas. Thanks very much indeed for being with us on the NewsHour today. So we have several new coronavirus variants, which all seem more easily transmitted. How seriously do we need to be taking these mutations?
Mutations are always a concern because they can either, most mutations make the virus non-viable. But there are mutations that can make the virus spread faster. That seems to be what we're seeing. Luckily, we're not seeing yet, or maybe hopefully we never will, mutations that make the virus be more dangerous to people. But even just increasing the infectivity of the virus without having worse results is concerning, because as more people are infected, it's going to overwhelm the hospital systems, which are close to that as it is right now, and also infect people who are at risk of serious outcomes or death. And so it's really important to keep up those non-pharmaceutical interventions, masking, social distancing, avoiding crowds, washing your hands, the things we have been doing for the last year.
And what do these new mutations mean when it comes to vaccines? Will the existing ones work, and will we keep having to create new ones to deal with these new strains?
Well, that's the $60,000 question. So far, at least with the variant that is found in the United Kingdom, it appears that the vaccines we have will be effective against this variant. There's more concern about the variant that has been found in South Africa, and there's some indication that the vaccine may not work. However, this is preliminary, and until studies are done, we really won't know for sure. And the COVID-19 virus is an RNA virus. They mutate, just like flu mutates. And we get a vaccine every year against flu, one of the reasons being that the virus has changed a little bit. That may turn out to be the case with this virus as well.
And we're hearing from the UK Prime Minister and others that vaccination is the way out of this pandemic. You talked about other measures like wearing face masks and washing hands and so on, but is vaccination the key?
Absolutely. We can wear face masks. You should wash your hands anyways, no matter what. We can stay socially distanced, but that's not viable going forward for decades, obviously. The best thing is to get everybody immunized and protected against the virus so that we can go back to life as we knew it before the pandemic. It's not going to happen right away. It's going to take a long time to get sufficient numbers of people vaccinated, but eventually it will happen.
Okay, really good to get your thoughts, Catherine Troisi from the Texas School of Public Health. Thank you for joining us.